Welcome to part 2. So in this lesson, we're going to be talking about using technology-based therapeutic tools in behavioral health. In this lesson, we're going to cover tools for clinicians, staff recruitment and supervision, sample telehealth policies. A variety of materials can be found online to assist behavioral health service providers who use technology in their practice and to help our clients use technology to support their recovery. So this lesson is going to include some selected resources for providers and administrators who are implementing that technology assisted care. And the materials included in this lesson are intended for modification based on the unique context, the service design, and the staffing configurations of a given program or organization. And they're only a small sampling of the wide array of resources that are available. So let's start out with some tools for clinicians. We want to talk about what are some of the things that we can pull out to help our clients. So we're going to start with the written statements to communicate or elicit emotional responses. Relying on written words to express emotion is going to be quite different from having in-person exchanges. But written exchanges can be particularly useful for specific types of people or maybe specific circumstances. In particular, this is going to be people who have previously experienced discrimination, or they may have some service access barriers, or the people who are concerned about preserving the anonymity of their participation in treatment. And they can benefit from counseling and support that relies on the written word rather than in-person exchanges. Nonetheless, providing clinical services via the written word is going to present some challenges for counselors and for clients. In exploring TAC implementation opportunities, understanding the various TAC-specific terms that you may encounter is key. So let's start this lesson off with some common terms that you should know. The term application, which is sometimes referred to as an app. So this is a software program that runs on a computer, a tablet, a mobile phone. And asynchronous communication. This is definitely a test question, so I'd pay attention here. Communication that once it's sent, it can be responded to later. So this is not live, I'm chatting, you're responding type of situation. This is, I'm going to send you a message and then maybe you'll respond to it sometime down the road. For example, email. It allows the recipient to respond whenever they wish, whereas synchronous communication requires a sender and a recipient to communicate at the same time, often back and forth as in like a phone conversation. So email can be considerably slower than text messaging, but some consumers may be more comfortable with that slower form of communication. Younger clients are often more experienced with texting and they prefer the more rapid communication exchange that's possible via that medium, as do many others of any age who are familiar with texting. Authentication. So this is some form of verifying the user of a given technology, like making them enter a password or a key code, a thumbprint, retinal scan, or a photo likeness. This would be like us looking at their ID. An avatar, this is just an icon or a picture or a character or a graphic that's just going to represent that person's online identity. Avatars are going to allow people to portray online identities without revealing their real images. And some people make them look like themselves, and some people make them look completely different from themselves. Bandwidth, this is the capacity of the transmission connection. Large bandwidth allows for more information to be sent in less time. So if you have a low bandwidth, you may be doing a video session and you start lagging. That would be a term used as well. You start becoming choppy and they can't hear you, or your screen starts to glitch. This is because you have a low bandwidth. The more bandwidth you have, the better your video quality is going to be. A blog, this is just a written thought, a link, opinion, or commentaries posted on a website. It's kind of like the op-ed piece in the newspaper. And broadband, this is bandwidth that is adequate to transmit a high quality audio visual data. Chat, this is online communication that occurs in real time. It includes chat rooms where people usually, there's several individuals in there, they're exchanging dialogue, as well as instant messaging, usually involving just two people. Desktop is the first display that you're going to see on your computer after it starts up. It's usually the background or the wallpaper where the icons or files and programs are saved on your computer. This is just what you're looking at once you log into your computer. And a desktop computer, this is a personal computer or a PC. That's what PC stands for, personal computer. It's to be used in one location as compared with a laptop or a portable computer, which is meant to be carried around and usually used in many locations. But a desktop computer is typically on a desk somewhere and it doesn't move. A domain, this is the last two parts of an email or a web address that shows the organization's name, like at gmail.com or at samhsa.gov. This is the domain name. So in an email address, you would have the at symbol and then the domain name. Encryption, this is just where encoding data on an email or web page, so it has to be decoded by the person or the system that's authorized to see it. In other words, if you don't have the encryption code, you can't see what data is in there. A firewall is either hardware or software that prevents unauthorized access to a computer network. A frame relay, this is just a streamlined process of sending and receiving data. Malware is a program that's loaded onto a computer system to compromise the confidentiality or integrity of the data, the applications, or even the operating system of the computer. And a network is just a set of locations or points or computers that are connected for information exchange. POTS, this is just the plain old telephone system or a landline. That would be versus the mobile or the cellular phone systems. Real time, obviously, it's just a form of sharing data or communication where there is no perceivable delay between the time something is sent and the time that it's received. Redundant, this is a backup approach to data processing or communications to ensure that even when one critical element of the system fails, the system is just going to continue to operate. A smartphone, this is a mobile phone that can do more than just make phone calls or send text messages. Smartphones can usually send and receive emails, access the internet, display photos, and play videos. Social media or networking, these are websites like Facebook, Google+, LinkedIn, Instagram, things like that, that allow people to create web pages with personal information and exchange messages with others. Store and forward, this is a transmission of images or audio clips to a storage device where a behavioral health service provider can view them, and it's going to reduce the bandwidth that's required. Synchronous communication, here's one of those ones that's a test question. Communication, where there is no lapse between the time that the sender communicates something and the receiver gets the message. This allows the participants to communicate in real time. And a tablet, this is a small, lightweight computer that often uses a touch screen instead of a keyboard. Teleconferencing, this is just an interactive communication between people, multiple users at different sites. It can include voice, video, and data. Telehealth, this is the use of electronic information and telecommunication to support that long distance clinical health care or any health related client and professional education, any public health, and also with health administration. Telemedicine, this is the exchange of medical information from one site to another through electronic communications to improve a client's clinical health status. and it can sometimes be used as a synonym for telehealth. Text messaging using SMS. This is a brief message that's typed into a phone or another handheld device, and it's sent by wireless telephone to another user. A tweet is a brief online posting that's distributed to a group of users that are registered as followers of a particular person's tweets. Twitter. This is an online service that manages subscribers' tweets. A URL, or the Uniform Resource Locator, this is just the internet, the address for a particular website. Video conferencing, this is real-time two-way transmission of video messages across multiple locations. And a video phone, these types of phones include an imaging device that lets the caller and receiver view each other like on a television. So the use of emoticons and acronyms is not really recommended for behavioral health service providers because of the risk of the misinterpretation and the blurring of the professional and personal relationship boundaries. However, providers engaged in text-based client communication should really understand some of the common emoticons and acronyms that their clients might use. Providers should verify the meaning of the communication from the client using the emoticon, and just know that they can carry multiple or ambiguous meanings. So, some statements to elicit responses from online clients. We want to make sure that we're getting the most out of this online setup. So, if we want to express empathy, we could say, "How sad," or "That's terrible," or "What an incredible ordeal." If we want to obtain permission, we could say things like, "Is it okay if I ask you some questions about whatever?" And "Are you up to some questions now?" If a client is saying something and they seem like they're backing off because it might seem a bit too outlandish, we want to start normalizing that. And we could say, "Often it's hard to blank," or "Often it's hard not to blank," or "Is it okay if you," or "It is okay if you blank." I know I have clients who will sometimes say things that they deem as, "Oh, that's inappropriate," and then they'll start to back off, and I'll say, "Oh man, that's that that's a lot to deal with. How are you not drinking?" We want to normalize what it is so that we can get them talking about it. When we're doing counseling, we want to make sure that we're restating from time to time. So we can say things like, "Correct me if I'm wrong," or "I get the impression that blank," or "I sense that you blank," and use some sort of feeling word or describing what it is that they're talking about. We want to nurture collaboration. So we can say things like, "Do you think it would be advisable to blank?" Or "As we've both said, blank," and just let them know that, "Hey, I'm here with you." We want to elicit commitment from the clients as well. So we could say things like, "What are one or two things that you should do first?" Or "How would you know if the effort was worth it?" And get them kind of thinking about that. And say something like, "So are you saying that you're willing to try doing whatever it is?" And we want that client to start thinking about actually moving toward that commitment. We want to promote credit for change. Give them, their props where they're due. So, how are things different this time than they were the last time? Get them thinking about how different it was back then and how far they've come now. You could say something like, "Well, what do you think accounts for the change?" Or "What, if anything, did you do differently this time?" We want to emphasize their strengths and nurture their hope. So some things we could say is, "Somehow you got past the obstacle of blank, is that right?" Or "What allowed you to blank in spite of blank?" Or "How did you do that?" We want to help them with their goals as well. So we could say things like, Does your goal seem realistic? Or maybe you should establish some sub goals. Or of your goals, which should you begin with? How how would you choose which goal to begin with? And how can you go about achieving these goals? And do you have a plan for that? And do you need help? We want to enhance their motivation. This goes back to the whole MI motivational interviewing. So, what's different when the problem is manageable? How would you like things to be different? Or of the things we've discussed, which are the most important reasons for you to change? And then we want to gather more information. The more we know, the better we are able to assist the client. So we can say things like, in order to understand your situation, I'd like to ask you some questions. Or, can you describe the situation that you're in now? Or, how often does this behavior occur? Or, what else should I know about you and your situation to help you with this problem? Here we're seeing some of the more common emoticons that are used in text-based communication. Again, always verify the meaning of the communication from the client using emoticons, as they can mean different things. And these are just some examples. Now there's entire keyboards that have pictures on them to show emotions using smiley faces, sad faces, crying faces, angry faces. And you can get a better picture of it, but you still want to ask every time. And here's some more of the common acronyms that are used in text-based communications. AAMOF, as a matter of fact, BBFN, bye-bye for now, or BFN, bye for now. BTW, which is by the way. BYKT, but you knew that. FITB, fill in the blank. FW, IW for what it's worth. FYI for your information. HTH, hope this helps. IMO or IMHO, in my opinion, or in my humble opinion. LOL typically means laugh out loud, but it could mean lots of luck or lots of love. So you might want to clarify with the client. You might not want to respond with LOL if somebody said they had someone passing, because they could mistake it as laughing out loud instead of lots of love. We don't want to have that miscommunication with the client. So again, try not to use acronyms when we are communicating with our clients, but confirm what they mean when we get those from our clients. NC means no comment, NP no problem, NRN no reply necessary, OMW on my way, TIA thanks in advance, TTYL talk to you later, and TYVM thank you very much. And as with all modes of service provision, some clients are better suited to TAC than others. So for the service to be effective, the client's strengths and resources have to match the selected treatment approaches. So the International Society for Mental Health Online in 2010 identified some considerations when screening clients for TAC. The first one of those is communication preferences. Does the client prefer in-person communication, video messaging, phone, email, instant messaging, or maybe chat? Is the client able to benefit from communication methods that they don't prefer? The next one is computer knowledge, skills, and resources. Does the client have access to a computer system or the internet? Is the client knowledgeable of their computer system and the internet? Does the client have the motivation or the capacity to experiment with new technologies? Are the client's computer resources compatible with the agency's or clinician's system? Does the location where the client accesses the computer or the internet pose privacy or technical concerns, including firewalls? If the internet access is interrupted, are there workable alternatives like email or a telephone? The next one is online communication knowledge. So does the client already use technology to communicate with other people? What type of experience does the client have with online communications? Does the client participate in online support groups? What's the quality of those interactions? We want to check for suitability of text-based communication. So what kinds of experience has the client had with reading and writing? Are there physical, cognitive, or any literacy limitations that would interfere with the client's ability to or their comfort with reading and writing? How well does the client type? Does the client enjoy that in-person or phone conversations, and why? Does the client prefer spontaneous communication like chat or IM versus taking the time to compose, edit, and reflect like when we're using an email? We want to check prior or current treatment experiences. Think about how might prior treatment experiences or expectations of treatment influence the client's attitudes about participating in online therapy. Does the client currently participate in counseling or therapy? And how might that experience influence this online therapy experience? We want to check out presenting or co-occurring problems. What's the most appropriate level of care for the presenting problem? And will online therapy be able to meet the needs of that client? Is the client suicidal or engaging in any risky behaviors? Does the client have problems or behaviors that might prevent them from responding to online therapy, like impulsiveness or difficulty with boundaries? Does the client have a physical health condition or a disability that might influence their ability to use online therapy? Does the client have mental or physical health problems that need to be continuously addressed visually, um, like slurred speech, tremors, or a flat affect? We need to check out cultural considerations. Are there language barriers that might create obstacles to text-based communication? Are there cultural considerations that maybe enhance or detract from the usefulness of online therapy? And lastly, we need to look at other resources or referrals. Are there any other resources that would better serve the client? Are there other supports or resources that can supplement that online therapy? So here's a checklist. I just wanted to let you guys have this checklist of HIPAA security policy considerations that are related to remote access and mobile devices, just to kind of go over. So user authorization to access electronic PHI. Is authorization based on role or a need for access? And is there workforce training prior to that access? Um, for security of devices outside the physical control of the organization, are the devices covered, like mobile phones, laptops, flash drives, backup devices? Is there virus protection for remote devices that are unattended? Is there a prevention of lost or stolen devices? Is there a deterrence of access to the PHI if the device is lost or stolen? In other words, can you wipe the device? Is there a backup or other procedure to avoid loss of electronic PHI if the device is lost? Electronic PHI that's sent over networks. Have you anticipated the uses and the risks, such as e-prescribing and webmail? Are you using secure connections? Are you using an email encryption? For workforce training, have you looked at access, storage, and transmission of the electronic PHI? Have you looked at password management, protection of the remote devices, prohibitions and procedures for transmitting that PHI using email, prohibitions and procedures for downloading the PHI to any remote computers? Or what are the consequences of any policy violations? Have you looked at the procedures and the sanctions for loss of control of that PHI? What about for lost and stolen logins and devices, or unauthorized access to any networks or devices, or unattended workstations, or virus introduction to any? Now let's spend a little bit of time talking about technology use in staff recruitment and supervision. A variety of measures are going to assess computer use, attitudes, and fluency, and these are available for organizational use. So I'm about to provide you with a checklist to initiate a discussion with your staff members about the comfort with and skills using technology. This list includes items from the computer, email, web fluency scale. More detailed questions about computer use appear in the original scale. You can also ask staff members to demonstrate their computer skills in a timed session. What kinds of technologies do you use in your work? What about lost or stolen logins or devices, email, EHRs, internet, social media, office software, video equipment, conference calling through telephone or mobile telephone? What kind of technology do you use in your personal life? This is the technology fluency that we're making sure our staff has. What do they use in their office life and what do they use in their personal life is what we're trying to determine here. How often does the staff member use a computer for work or personal reasons? How long has that person been using the internet? How comfortable are they with computers in general? How comfortable are they using the internet? There are some distinct competencies that supervisors who oversee TAC have to master. These competencies are generally derived from using technology in their own practice. In addition, supervisors who use technology to deliver long-distance clinical supervision, they have to have a distinct set of competencies if they're able to adequately be prepared to use technology to conduct that supervision effectively. So let's go over some of the technological competencies for supervision. Um, and this is for the supervision of TAC and supervision via technology. So you can see each one is checked off on the right-hand side. So all of the knowledge-related competencies required of clinicians. Ethical and confidentiality concerns that are related to transmitting clinical information. Both of those are going to be used with supervision of TAC and supervision via technology. Clinicians need to know the benefits of technology delivered supervision, the scope of practice requirements and risk, the regulations that are related to the delivery of technology based care, the regulations related to the delivery of technology based supervision, organizational policies on privacy, confidentiality, security, and informed consent, a common ethical privacy, security, and risk management issues that are faced when providing technology-based clinical care, and also those same issues when providing technology-based supervision. The skills that we need to have all of the skill-related competency required of clinicians, obviously. But we also need to have the development of working alliances with and discerning nonverbal cues of the supervisees when using technology. We need to be able to identify red flags in clients through text, video, clinical records, and also clinician reports. We need to make sure we have the strategies to structure technology delivered supervision and the ability to make a remote supervision session lively and relevant to clinical rather than administrative supervision. We have to have the attitudes of having an interest in adoption of new practice and supervision techniques and a willingness to work through any technology interruptions or glitches. Policies and procedures are going to vary based on the type of technology that's used, the risks that are associated with that intervention, the organization's regulatory climate, and the size and the scope of the organization itself. The sample policies that we're about to talk about are adapted from an internal policies and procedure manuals that was developed by the Billings Clinic in Billings, Montana, and it was provided by TIP consensus panelists Thelma McCloskey Armstrong. And these are going to provide a snapshot of some issues that organizations might want to consider in developing their policies for technology assisted services. Some of the sample policies clearly relate to telehealth for physical disorders or when a telehealth provider may need a close or thorough physical view of the client. Although telebehavioral health will not often require such a physical review of the client, the policies have been included to foster integrated care in the case of telebehavioral health administrator wishes to share these sample policies with a general telehealth care administrator. Let's talk about room evaluation. The goal of this section is to provide a process for evaluation of the room to ensure optimal conditions during a telemedicine consult. So we're going to look at sound. A quiet room is ideal. Fabric like curtains or walls and carpeting are going to be beneficial to reduce the reflection of sound in the room. We want to be aware of ambient noise. Listen for fans, furnaces, air conditioning, overhead speakers, vacuuming, and noises from nearby rooms. We want to eliminate the noises if possible. If the room has a phone, turn the ringer down, mute or turn the volume down on any intercom systems if that is an option. For the walls and the windows, solid blue or gray walls are ideal. You want to avoid patterns on the wall or wallpaper. Walls behind the client might be covered with maybe a blue cloth because blue enhances skin tones. We want to cover the windows with a darkening curtain. And we want to note objects in the room that might be distracting to cameras or participants and keep items such as light switches, screens, or reflective items out of the frame. For the lighting, fluorescent lighting creates a good video. The bulb should be 3200 to 4700 degrees Kelvin. An average fluorescent lighting is about 3500 degrees Kelvin. Most fluorescent lights are directed down into a room, resulting in darkened eyes. Ideal lights are directed to reflect off the ceiling, and that results in indirect lighting. Other options are going to include front lighting or lights mounted on the walls to direct the light at the front of the participants. So the key points here, solid backgrounds without patterns, eliminate the background noise, and curtains should block daylight coming through the windows. Client positioning. In this part of the lesson, we're going to be talking instruction on positioning a client for an exam over telemedicine for the ultimate visual clarity and safety. We want to seat the client so that they have a clear view of the consultant on the monitor. We want to place the monitor so that the presenter may also see the video that's being sent to the provider. We want to note the camera angles needed to ensure that the provider sees the exam without the presenter blocking the view. This may involve the use of more than one camera for various parts of the exam. Determine the client's mobility status. The client may be asked to walk, jump, balance, squat, or arise from a seated position. So inform the provider of any concerns. Stay by the client's side for the assessments. Provide a safe, obstacle-free environment. The client may be initially seated in a chair and later moved to the exam table. The client may need to turn so the camera views the back while assessing the lungs for sound or other views involving the back. This may also be accomplished by using two cameras being present. So have a blue cloth draping available during the consult. Blue is going to enhance the skin tone. Camera placement. Several cameras should or can be used to evaluate clients for clinical visits, including Polycom video conferencing cameras, document cameras, and peripheral cameras. The high-def camera, this is the primary camera. We want to frame the client in the picture slightly left of center to allow space for the picture-in-picture at the consulting site without obscuring the client. If more than one person is attending the consult, place the chairs close together. Preset the camera settings so that each individual is visible alone in a close shot and together in another shot. We want to preset a close shot of the client's upper body and a full body shot. The provider can better assess posture and nonverbal communication with these views. And when adjusting your camera, try to fill the screen as much as possible with people rather than with the table, chairs, the walls, the lights, or the floor. For the document camera, use a preset for the document camera. It may be used by either the provider or the client to share printed matters, pictures, x-rays, or three-dimensional objects. It might be used to assess hands or arms. The lighting and magnification are ideal, so use a blue background to enhance any skin tones on this one. The peripheral camera, we want to use a tripod. Even minimal movement made while holding the camera is going to be magnified on the screen. When practical, it's preferable to use the tripod. Use a preset for the peripheral camera. Refer to the camera instructions to white balance and focus the camera prior to each use. Compare skin color on the monitor, the screen, with the actual color off camera to determine accurate color settings. To assess gait, place the camera 12 to 18 inches off the floor. The provider has to be able to see feet and legs and arms and the torso of the client. When assessing skin, use a blue cloth pad or blue drape for the background. For close shots of the skin, it's best to set the camera for a wide shot and then move the camera very close to the skin. Be aware of any camera angles when showing the right and left sides of the body. So, for example, when shooting arm reflexes, allow the presenter to be in the alignment needed and work around him or her. For microphone use, we want to make sure that we're placing the microphone at least 3 to 5 feet away from the video conferencing unit. We want to place the microphone at least 2 feet from the speaker facing away from the monitor. We want to speak in a normal tone of voice, not shouting. And we want to note that the microphone is very sensitive and will pick up and amplify noises like clicking pens or shuffling paper. If the microphone must be relocated during a conference, mute the microphone and then move it to the new location. If one site hears an echo or a sound distortion over the video conferencing equipment, the most likely cause is microphone placement at the site. The solution is for the offending site to move the microphone away from the monitor or the speaker and turn down the volume. We want to mute microphones when a call comes into the site to protect the confidentiality of the participants until they're ready to join the conference. We want to instruct the users in the control of the mute button and the volume adjustment on the remote. Limit side conversations if there are additional people involved in the consultation. Ask the people at the other site if they can hear. Have them introduce themselves to evaluate the sound quality. And we want to pause briefly for others to answer or make comments due to the fact that the audio may have a very slight delay. For privacy, we want to place a sign on the room's door noting that a private consult is in session. We want to allow the consulting provider or designee to introduce any other individuals in the room and ask the client's permission to have that individual present during the consult. If the client denies permission, the individual will exit the room. Allow the consulting provider to pan the room with the camera at the client's request to assure that the client that no other parties are attending the consult. Ask the client their preference regarding the site facilitator staying in the room. Repeat this question at each visit. Have the site facilitator wait outside the room or leave a number that the client may call for assistance if he or she is not in the room for the consult. If the facilitator will not remain in the room for the consult, adjust the camera prior to exiting so that the provider sees the upper half of the client's body unless instructed otherwise. We want to inform our clients about the video conferencing system and its capabilities, its risks and benefits. We want to review with them the process that will occur during the consult. We want to obtain any consents for participation in the telemedicine consultation and maintain the original in the client's medical record at the consulting site. A copy can be made for records at the client site. We want to give clients the option of terminating the telemedicine encounter at any time and opting to see the consulting physician in person. For client preparation, the goal here is to provide instruction for you guys in educating the client in preparation for this telemedicine encounter. So when the initial telemedicine appointment is made, we want to instruct the client to arrive 15 to 30 minutes before the appointment with the consultant. We want to instruct those who must complete registration forms to arrive 30 minutes before the appointment and to bring their insurance cards and a copy of their current prescriptions. In some cases, the consulting doctor's office may send forms to the client to be completed and brought to the visit or mailed back to the site prior to that visit. If a client arrives with completed forms, we want to fax these forms to the consulting provider. Give the client the site location name and the address and the site facilitator's name and phone number. If the client is seeing a blank provider from whatever agency, the rural site is going to register him as that agency's client. In the case of a follow-up visit by a previously registered client, further registration may be unnecessary. The telemedicine nurse will notify the site if registration is required. Client bill is going to come from the consulting provider. Make sure to introduce yourself to the client and escort the client to the exam room. Explain the telemedicine visit and give the client a chance to ask any questions. We want to make sure that we're covering a few points. One, that the provider is located in an office in a distant town. The client sees the provider on a monitor just as the provider sees the client on a monitor. There are cameras and microphones at both sides. The consultation is private. We want to ensure that the introduction of each person in the rooms at both sites and the issuing of the statements as to the role that each person plays. We want to introduce any additional peripheral devices that are going to be used, like cameras, electronic stethoscopes, a document stand, or a video otoscope. There may be a need to get a close view of the client during a camera or using a camera during the consult. The client may be asked to don a gown so that the physical assessment can be completed. We want to take turns speaking so that all participants can hear the conversation. If the provider wants a certain person in the room to answer a question, the provider will specifically address that individual. Allow the queried individual to respond. Sometimes providers are assessing speech, cognition, or memory. So if the client isn't comfortable with any part of the exam, they can refuse to continue that portion of the exam. And if the client wants to speak to the provider privately, instruct him or her to let the site facilitator know and encourage the client or the family to ask the provider questions. All right, so now let's talk about the process for scheduling telemedicine appointments. Option number one, when a provider or client requests a telemedicine appointment, we want to call the telemedicine office, the provider or the main office. We want initial information that's required. That's going to include the type of specialty consult needed, the referring provider's name and number, and the sites connecting for the consult. Telemedicine staff may need to contact a consulting provider to determine whether the request can be met. The consulting provider may request further medical information to determine whether that client is appropriate for a telemedicine consult. The telemedicine office will set the date and the time after consulting with the client, the provider, and any other individuals who must be present, like presenters or referring providers, and also consulting the schedule. Site facilitators may assist in this communication. Client's initials are logged in the scheduler. The telemedicine nurse or consulting office staff notifies the site of the client's name. The telemedicine nurse will determine what equipment needs there's going to be for the appointment and inform the site. And put a note of these in the reservation. The appointment scheduler is going to email appointment information automatically to all involved parties. The scheduling of the follow-up appointments will occur in the same manner as I just described. Option number two, When a client or provider requests a telemedicine appointment, we need to place a call to the telemedicine office or the central appointment desk or the consulting specialist office. We need to request client information from the caller, and the scheduling process is going to continue with those other steps in the first option, which are logging them into the scheduler and figuring out what equipment needs there's going to be. And then, of course, emailing everybody that there is an appointment set. Now let's talk about ensuring that proper documentation occurs with the telemedicine consults. We want to ensure that a client who participates in the telemedicine visit signs a client consent for a telemedicine encounter form. If the client previously signed this document, they don't have to sign it again. We just want to make sure that we're sending the original to the consulting site to be filled in their medical or filed in their medical records at the provider's office so that they have a copy to keep. We want to give a copy to the client as well. We want to register clients seeing any providers for the first time into the system. Clients must complete forms in the registration packet that is located at the rural site, including conditions of the registration, any face sheet for the agency, and any Medicare secondary payer if they are Medicare eligible. We want to refer to the agency telemedicine registration for new client instructions. We want to send original documents to the telemedicine office for inclusion in the agency's chart. We want to offer each client a question and answer form to complete and a self-addressed stamped envelope to mail the completed form back to the agency office if it's desired. The site facilitator is going to send those completed forms to the agency's office in the event that the client leaves the form at the rural site. We want to allow clients to bring to the visit any forms that they've received from providers to complete prior to the visit and send these forms to the appropriate provider. Before the visit, we want to review any clinical guidelines to determine if this type of visit requires additional information or questionnaires, and consider making copies of these documents accessible on the members only section of the agency website. We want to prepare for visits that may require documentation of client vital signs like their weight, their temperature, their pulse, respiration, blood pressure. The site facilitator may document vital signs on the visit template if appropriate and send them to the provider or verbally report them to the consultant. We want to keep all original documentation at the consulting provider site, as is the case with in-person care. We want to keep copies at the client site at the discretion of the regional center. We want to make sure that consultants have documents in place for a telemedicine consult. So we want to make client records stored at the client site readily available during the consult. The consulting provider or staff person working with the provider may request that you provide certain documents prior to the consult. We want to follow the rules that govern sharing of medical information. A consulting provider may access client information from a referring doctor. Documents requested may include a referral note, lab reports, x-ray reports or films, scans, any other studies. We want to send client records at the consulting site to the provider in the same manner as occurs with an on-site visit. We want to make a computer with access to the client's electronic medical record available for use by the consultant at the time of the visit. We want to ensure that the client receives the required prescriptions following a telemedicine encounter. So during a consult, a provider may choose to order a new medication or to change the medication the client is currently using. The provider may ask the client what pharmacy they use and order the prescription directly. The provider may mail a prescription to the client, or the provider may fax a prescription to the pharmacy that is used by the client. So some additional tips here. When presenting a client or planning to be on camera for another reason, we need to be aware of clothing choices. Solids are preferable to any checks, plaids, geometric shapes, or stripes. Red, vibrant orange, hot pink, or white, these can cause a color bleeding effect over video. The color of choice is blue as it enhances natural skin tones. A blue drape or a cloth pad should be available for all medical consults. Covering carpet to examine feet or draping the client to better examine any limbs or face or cover distracting clothing is important to provide quality pictures. Client gowns should be blue preferably or a solid color. If a provider inquires about a specific area on the client, offer to show that area to allow for assessment. Providers may not be certain of the technology or the convenience of moving the cameras. Observe the client for gait, posture, effects, care of clothing, odor, maybe alcohol or body odor, and also for tremors. Report observations to the provider via the system or by phone when the client is not present. If appropriate, bring up the topic during the encounter. You may say, I noticed that you're unsteady when you're walking. Model good communication for the client. Encourage the client to ask questions of the provider. If the client has shared a concern prior to the visit, be certain to bring up the topic for the provider to address. Like, hey, Mary mentioned that she's noted increased ringing in her ears since she last saw you. And lastly, you're the connection to the provider. You are the key to a successful consult. The policies presented in this lesson serve only as an example of how one agency has formulated its telehealth policies. Every administrator has to make decisions that are going to reflect the clients, the agencies, the services, and also the circumstances at hand. And such policies will require updating due to changing needs and circumstances and also of changing technologies. All right, this brings us to the end of the telemental health training. Congratulations on completing. In order to receive your certificate, you're going to need to go to the course completion section and complete the course survey and successfully pass the quiz for the entire training. Upon passing the quiz, your course certificate will be emailed to you. Once you finish the course, make sure you check out our other courses on our online course page of our website at georgiareentrycenter.com. Thank you all for completing this. And if you have any comments or concerns or questions, please put them in the comment section in the lesson that you have a question about.